Hello, dear listeners. Today we will talk about strokes, their types, and symptoms to recognize its development. We will also go through the first aid in these situations. The brain is the center for analysis and management of the well-coordinated work of all our organs. Nerve cells or neurons that perform this work need a constant supply of nutrients and oxygen. Therefore, two pairs of arteries, carotid and vertebra, go to the brain. Together, these arteries form a common arterial villous circle, sending the branches to different parts of the brain. Blood supply to neurons is regulated by reducing or increasing the lumen of the arteries. Sudden blockage or rupture of vessel leads to the failure of blood flow to neurons. This condition is called acute cerebral circulation disorder, or stroke. Oxygen-deprived neurons are unable to perform their functions. A stroke can happen to a person of any age. Many believe that strokes occur only in adults after 40 years. However, statistics shows that it usually happens to children, especially newborns and infants. Furthermore, in a young person, the stroke has less typical signs. Therefore, the longer he will be left without help, and the more sad the consequences of the brain disaster may be. The risk group includes diabetes mellitus, hypertension, arrhythmias, blood clotting disorders, obesity, and smokers. Hundreds of thousands of strokes are registered annually in civilized countries. Unfortunately, if you miss the first minutes of the terrible disease, the process becomes irreversible. This is why it is essential to know the first aid in case of stroke. A stroke occurs when one of the brain arteries gets blocked or ripped. Therefore, there are two types of strokes. Hemorrhagic stroke is the most dangerous type of disease with a severe threat to life. It is a brain hemorrhage when blood comes out from the ripped artery. Ischemic stroke is the most common type. The brain damage occurs due to low blood flow, when the clot completely blocks the vessel's lumen, resulting in a lack of oxygen. Ischemia violates the normal blood flow and brain cells' death begins. The process of damage of brain structures can develop extremely rapidly. So the longer a victim does not get proper medical care, the more irreversible changes occur. A stroke appears suddenly, often without any signs at any time of a day. At this moment, a victim's life depends on who is around and how quickly help will be provided. 3-6 hours separate the victim from irreversible changes in the brain or even death. What are the main signs of a stroke? The symptoms, as a rule, develop very quickly. The scenario is approximately the same, can only change the sequence of their occurrence. Usually, a person has a weakness, sleepiness. A sharp interval headache occurs, often after stress or physical work. The victims complain that the head literally tears. Their gait, balance, and coordination get disturbed. There may be a sudden loss of sensitivity or weakness, especially on one side of the body. Stroke is characterized by unilateral paresis, when the muscle weakness manifests only on left or right side of the body. Therefore, the victim's facial features change. You can notice the drooling on one side of the face. Next, there is the speech disorder, a full mouth feel. Speech becomes less precise. Either it slows down, or conversely, a person starts to babble unclearly. The victim may also complain about fog in front of the eyes, defocusing or double vision. It becomes difficult for the victim to formulate his thoughts and choose words. There is a simple and reliable test that allows to recognize a stroke in 80% of cases. It's called face-arm speech test, or FAST. The FAST algorithm is the following. Face. Ask a person to smile or show his teeth. In a stroke, there is a noticeable face asymmetry. The mouth on one side hangs. Arm. Ask a person to rise and hold both hands for 5 seconds by 90 degrees in sitting position, or 45 degrees in laying position. In a stroke, one of the hands is lowered down. Speech. Ask a person to say a simple phrase. In a stroke, a person cannot pronounce a simple sentence clearly and correctly. His speech is illegible. Even one symptom indicates stroke development. When providing first aid, the main rule is not to hesitate. If any of these signs appear, call an ambulance immediately. While you are waiting for the ambulance to arrive, there are a few simple rules that can significantly help a patient with a stroke. Lay the victim down so that the head and shoulders are above the torso. If older people have dentures in the oral cavity, take them out. Undo all tight clothes, open the window, provide access to fresh air. It is essential to make sure that the victim can breathe. If you find a respiratory problem or there is a possibility of vomiting, you have to free the airways, putting the patient on his side and clear the mouth. If possible, measure the blood pressure and determine the sugar level in the blood. Record the results and report them to the ambulance crew when it comes. If the pressure is high, give the medicine that the victim usually takes in such cases. If the stroke happened at home, you could put the victim's leg in hot water. It will open the leg vessels and decrease the pressure. But do not lower the blood pressure too fast. 10-15 mm mercury column is optimum. Warning: the vasodilatators are absolutely contraindicated during the acute period. In ischemic stroke, they do not dilate the injured vessels, but intact areas of the brain. As a result, blood goes there while oxygen deprivation in the damaged regions exacerbates. In hemorrhagic stroke, the vasodilatators can even kill the victim. If you suspect a person having a stroke, do not feed or drink him, as the swallowing may be impaired. If the victim has breathing but no consciousness, put him in a stable lateral position. If he is unconscious and not breathing, immediately start CPR. To sum up, you have learned what a stroke is, the type of strokes, the symptoms to recognize. You have also analyzed the actions in the first aid before the ambulance arrived. To summarize the material, let's watch a small video.
I'm sorry, I'm late.
That's okay, thank you, that's so beautiful. Oh, by the way, what time is it? What's wrong? Are you okay? Quick, raise your hands. Oh my God, you may have a stroke. I need to call an ambulance.